Hi, my name is Prashana Buratoki and my student ID is U3212147 and this is my student ID card. I will be demonstrating the care of patient on an orthopedic ward, and according to the case scenario, Elsie is a 65-year-old woman who has been brought into hospital by ambulance after a fall at home. She has suffered a fracture of right neck of femur and had a surgery 2 days ago with no complications of the surgery. She has a history of hypertension and cardiac disease. Her vital signs are within normal limits and an X-ray had been conducted and the examination shows she is suffering from osteoporosis and she has been commenced with calcium and vitamin D supplements for it. She she had a surgical incision which is clean and intact under a clear surgical dressing with a minimal post-operative ooze. The dressing is to remain intact for another 7 days. She is mobilizing slowly on a frame and is seen by a physiotherapist for her daily mobilization and leg exercise. Her pain has been well controlled by analgesia and indone. Considering her considering her current situation, the three priorities would be pain management, wound management, and mobility care. For pain management, as she has been recently had a post-operative surgery and has a wound dressing, she is taking PRN, paracetamol, and indone occasionally. I will be conducting pain assessment using the PQRST module, which stands for provocation, quality, reason, severity, scale, and timing. I would also ask her about her pain before and after the paracetamol and use AbbeyPain scale for her pain. I would also conduct timely reassessment and check her vitals time and again for her pain. Secondly, for the wound management, as she had recently had a surgery and is in post-operative care of NOF, she has a dressing that need to be intact for 7 days. So I would make sure I will use antiseptic non-touch technique to keep the wound clean and check her oral antibiotic effect. Check for debridement while dressing and also continually reviewing her wound for redness, swallowing, and infection. Thirdly, third priority for her would be mobility care, as Elsie is in post-operative care of NOF and suffers from osteoporosis as well as she is in high risk of blood clotting. I would make sure she has a TED stocking on whenever she is walking. She also needs supervision during her walking and daily living like showering, walking, and everything else. We should also consider pressure area care in her case, as it is very important to make sure we reposition her time and again to prevent any kind of pressure injuries. And she also suffers from incontinence, so I would be considering to provide her with incontinence aid to prevent any kind of accidents during her stay. The three primary healthcare workers to support her during her return of home would be occupational therapists who would be helping her to improve her independence and also provide safety for her, and they would also help her during her rehabilitation and discharge. Secondly, I would consider a physiotherapist to review her and help her with her daily movement and different kinds of exercise for her joints and reduce any kind of pain and restore normal mobility of the joints. Thirdly, I would recommend a dietitian for Elsie who is having a loss of appetite to maintain and gain back her appetite and provide more nutrition and nutritious food and advanced diet, which and also avoid any kind of food allergy and to promote health and manage different kind of disease. So when I will be approaching LC, I would be considering the 5 moments of hand hygiene for infection control, which would be before touching the patient, before cleaning aseptic procedure, after bodily fluid exposure, after touching patient, and after touching patient surrounding. Firstly, I would like to introduce myself to LC, and after introduction, I would be correctly identifying the patient with I would be firstly checking her name, date of birth, and URN number, comparing it with the file notes of LC and the wristband on her arms. I would also ask for address and check if there's any kind of photos, and also have a look at any kind of allergy or any history of allergy. After that, I would consider giving her medication and check 7 rights and 3 checks, and also have a look for the side effects of medication. So firstly, there are 8 rights which needs to be considered. They are right patient, right route, right dose, right expiry date, right documentation, right to refuse, right drug, and right time. I should also be educating the patient about what the medication is used for, and if it has any kind of side effect, and call us if there is any kind of effects. The 3 checks of for drugs like acid and S4 or any other kind of medication would be to when we pull out the medication before dispensing correctly, and check the correct expiry date, correct dose, not only outside but also inside, like the file, and also mix. And the second check would be while preparing the medication, and the third check would be on the bedside of the patient just before administrating the medication. Thirdly, we could also see that there have been error in the medication chart, as the medication hasn't been correctly written down, or the medication name has been missing in the medication chart. So I would like to inform the doctor about this, as it can be a serious issue for the patient. As for the discharge, I would like to be educating the patient on self-administration of medication, like making a considering a Webster pack for her if she has any difficulties in knowing the right medication, with and help her recognize the right medication with different colors, and separating it with the day and night, breakfast, dinner. I would also like to refer community service if she is not able to help herself, and I would like to provide a discharge summary for and contact the family as well as her. I would provide her with a discharge medication list and detailed medication information about how the generic medication name, doses, right dose for the medication, right route, and PRN medications as required, and recommend to use for home medication reviews as well. I would also provide the patients and the family about any concern to contact if they have any concern regarding the discharge. And I would also educate the patient about proper storage and use of medication, and what to do if the dose is missed, and the potential side effects of the medication, and when to call the GP or pharmacist about any concern. Finally, I would also give them the arrange any kind of medication, and give them the contact contact of the pharmacist and hospital if they require any medication. Thank you.